So today's topic is about the cytoskeleton. It is an important structure that is found in the eukaryotes. Especially within this, I will be looking at the entities that are involved in the production of the cytoskeleton as well as few clinical aspects regarding the defects that are involved and associated with some of the entities that are involved in the formation of the cytoskeleton. So if I give a brief introduction, it is an array of microtubules. Array of microtubules. This includes microfilaments, which are known as the actin. These are primarily termed because of the fact that they have a very small diameter, and the intermediate filaments. Intermediate filaments, in fact, have somewhat a larger diameter in comparison to that of microfilaments, but not as that of myosin. So there are multiple number of units that are associated with these microfilaments and intermediate filaments, which we'll be looking into. But in prior to that, you should know that these elements are important in both the provision of the definitive shape of the cell as well as important in movement of organelles and vesicles intracellularly. So primarily, if the cell needs to change its shape, such as in circumstances where it has to undergo phagocytosis, engulf cells, then of course these microtubules plays a key and an important role to make sure that the flexibility of the shell is seen. So prior to going into details about the cytoskeleton itself, I would like to look at a question that was posed in the previous examination. These consist of 5 statements which have a rather a theoretical aspect, and these questions are a bit tough and difficult to answer if you do not have the accurate knowledge about how the cytoskeleton is formed and what its structures are composed of. Now, looking at the first statement, it is given that intermediate filaments are formed by polymerization of tubulin dimers. Now, if you can remember the exact structure, as I said, the cytoskeleton is composed of both microfilaments as well as intermediate filaments. Now, looking at the intermediate filaments, what you see is that there is the presence of two proteins in an antiparallel manner showing heterodimerization. These are rod-like proteins which composed of an alpha helical shape and a coiled coil structure. So these, once they are bound in an antiparallel manner, they are involved in the formation of intermediate filaments. So this, in fact, is not composed of two dimers of tubulin. I would like to look at some of the types of intermediate filaments that you come across. This is rather in addition, but these might sometimes be evaluated in your examination, specifically within the MCQ. So there are few types, usually 5 types that we come across. There are sixth as well. The sixth is not very important. I'm going to look at the first 5 types. Type 1. Type 1 is called the acidic and the basic proteins, intermediate filaments, type 1 and type 2. Now these are in practically they are keratins. Keratin, this is an acidic one, whereas this is the basic intermediate filament. So these are found in the epithelium of the skin as well as in the hair and the nails. So if there's any sort of a problem that is associated with these types, what you would see is that there is the loss of integration of the skin epithelium as well as the other structures that I said. So type 3 is also known as a protein It's a heteropolymeric protein. These are found, there are four types in fact. There's the desmin type 3 composed of desmin, which are found within the sarcomere of muscle cells, striated muscles, desmin. And then there's the glial fibrillary acidic protein, also termed as GFAP. This I have related within some of my previous videos when I was stating about neuroglia. Now these are important filaments that are found within the astrocytes and are crucial for the functioning of the neurons because of the support that is provided by them. Now, as I said, even this has a clinical importance as well. Glial fibrillary acid protein GFAP is used as a tumor marker for astrocytoma because this might be elevated in circumstances where there is excessive division of astrocytes, in fact, in a brain tumor. And the third type is known as peripherin, which is found in the neurons, usually within the peripheral neurons. Important structure within the ends for the neural transmission to take place. And now the fourth type is known as the vimentin, which are found in leukocytes and endothelial cells, again provides support to these cells. In addition to this, you can also see another atypical type of a protein which is known as syncoilin. Not important, but just if the term is given in some place, you should know that this is a type 3 intermediate filament. In addition to that, there is type 4 as well. Again, type 4 consists of few proteins that are important in uh, some of the cells that are found within the neuroglia as well as the neurons. And there's the type 5, which is more or less an important one because it produces the nuclear envelope. So these are the types of intermediate filaments that you come across. If there's any defect or dysfunctioning in the production because of a mutation, what would happen is that the integrity of the cell might be disrupted. This might lead to few diseases such as it could be cardiomyopathy because it might show extensive stretchability. This might be a dilated cardiomyopathy, or sometimes the absence of elasticity will lead to restrictive cardiomyopathy. So both are possible. In addition to that, especially when you lose the integrity within the skin, you would see an individual having a certain skin disorder, which is known as the disease epidermolysis bullosa, and other blistering skin disorders. Right. If laminin is involved, this might show laminopathies. Again, these laminopathies, which play an important role in the production of in the formation of the nuclear envelope, will have certain defects such as there are multiple defects which you do not want to be concerned about it right now, but just know that it again can show few problems such as lipodystrophies and disorders within the striated muscles. So intermediate filaments. So the first statement, intermediate filaments are formed by polymerization of tubulin fiber dimers, is a false statement because it consists of two rod-like proteins that are present antiparallel to one another, which has a helical and a coiled structure. The second statement is about tubulin. What it says is tubulin polymerization inhibitors are potential anti-cancer drugs. Now, tubulin polymerization. Tubulin polymerization, if you can write, this shows a tubulin. This tubulin is present in a very, it has this dynamic structure. It involves in formation and destruction as well as reformation in a very cyclic manner. Therefore, it has this dynamic structure. The dynamicity is maintained by the action of GTP as well as the processes of polymerization and depolymerization. Now, there are two subunits that are involved in the formation of these microtubules, which are alpha and beta. So, these are the two subunits, alpha, beta tubulin. These are wound and placed in such a manner so that it produces these microtubules. However, something that you need to consider is that these are organized, the orientation is organized by means of certain places which are known as microtubule organizing centers, MTOC. These are found within the centrosomes. Now, these microtubules, as I said, they have their function in intercellular transportation, particularly both organelles as well as vesicles. Now, if you look at this in a more detailed manner, now for the production of microtubules, it requires alpha and beta tubulin. Now, this has to undergo polymerization. If this is present, then microtubule formation is possible. However, for the polymerization, it requires the action of few cofactors that bind to three sites. These sites include the vinca binding site, the colchicine binding site, as well as the taxane binding site. If all of these sites are accompanied and functions well with the cofactors, then of course the polymerization process takes place in an unhalted manner. However, it has been found by using certain chemicals to bind instead of the cofactors to these specific type sites, we can make sure that the polymerization is somewhat hindered. Now, why do we want to do that? If you look at this, now microtubules are an important component for cellular division. It is important criteria for the mitosis to happen. Now, see, these are microtubules which will bind onto the chromosomes and involved in partition of these chromosomes, where it's an important function within the mitosis itself. Now, if there are no microtubules, mitosis will not happen. Simple as that. So, to hold mitosis, we can use these sites to disrupt the microtubule formation or the polymerization. So, where do we need this? Mitosis should be reduced in circumstances where there is excessive cellular division. In turn, it is called tumor or cancer. So, for purposes of altering the cancer development or the excessive division of cells, what we can use is that we can use inhibitors for tubulin polymerization. Usually, the two types that we come across are colchicine and vincoblastin. These are the two types. Uh, These drugs are specifically used for cancer purposes, especially when there is metastasis. In addition to this, there is also another drug which is known as uh, paclitaxel, which binds the taxane binding sites. These are tubulin depolymerization inhibitors, whereas colchicine and vincristine are polymerization inhibitors. Both of these, once these functions are not well maintained, what would happen is that it will disrupt the dynamicity of the microtubules and thereby will have an impact on the cellular division. So the question is about tubulin polymerization inhibitors are potential anti-cancer drugs. Yes, it is not potential, but it is being used in oncotherapy, where we see multiple agents that are utilized. So this is a true statement. The third statement says about disintegration of a nuclear envelope during mitosis is initiated by phosphorylation of nuclear lamins. Now, as I said, the nuclear envelope The nuclear envelope is a barrier that is present between the nucleus and the cytoplasm. So, barrier between the nucleus and the cytoplasm. Each time, now it regulates the material that are passed in between these two regions. Each time when cellular division has to take place, this nuclear envelope has to be broken down. The contents of the nuclear envelope includes the nuclear lamina, composed of intermediate filaments, and pore complexes. So these are the constituents. Now, each time when the cellular division is to be taken place, what would happen is that the nuclear envelope will be disrupted and it breaks down. This usually happens within the prophase and reforms and in the telophase. From prophase to telophase, it is broken and reformed. The main functioning of the nuclear envelope is that it specifically regulates the material that are transported in between the nucleoplasm and the cytoplasm, as well as it provides these anchoring sites for the cytoskeleton. So important in maintenance of the integrity of the cell as well. The inner face of the nuclear envelope is associated with the nuclear lamina. This is composed of the nuclear lamina, whereas the outer face is usually continuous with the endoplasmic reticulum. So this is shown expressively in a very illustrated manner in this particular diagram. So there are two membranes, the inner face as well as the outer face. The inner face is usually with the nuclear lamina, whereas the outer face is continuous with the endoplasmic reticulum. This is why it is important part in the process of translation. Now, if there is some sort of a mutation that is been affecting the nuclear lamina or the pore complexes, what would happen is that it will lead to few defects, mutagenic defects, which are usually the types are of versatile nature, but you need to remember that it could lead to lipodystrophies, specifically dystrophies, partial lipodystrophies, and along with that there are possibilities of striated muscle disorders. So the statement disintegration of the nuclear envelope during mitosis initiated by the phosphorylation of nuclear lamins, that is true. Nuclear lamins are the ones that will be so as I said, for the mitosis to take place, it has to undergo disruption and it will be reformed during the telophase. The nuclear lamins is the one which usually initiate the disruption process. The nuclear lamins has to undergo phosphorylation initially for the commencement of this process. So this is a true statement. Look at the depth in which the questioning has been given. So, the first statement gives defective microtubule structure in flagella causes infertility. Again, an important thing that we see in some of the, particularly when it comes to respiratory pulmonology, where in respiratory dysfunctions as well as some of the diseases that are involved with the respiratory tract, we come across this term where there is this uh, microtubule dysfunction. This is known as primary ciliary dyskinesia. Why is that? Because the microtubules are an important structure in the formation of both cilia as well as flagella. Microtubules play an important component in the formation of cilia and flagella. Now, where are the cilia and the flagella found? Now, if you can remember, the sperm has a flagella. Microtubules is important in mitosis, as I said previously. Microtubules. Whereas you would see the presence of cilia in the respiratory tract, cilia in the respiratory tract, in the vas deferens, as well as the fallopian tube. So once the production of the cilia and the flagella are somewhat uh, malformed or malfunctioning, what would happen is that it will have its imposition on all of these structures. The functioning will be somewhat disrupted. Hence, you would see problems associated within these structures as well as these systems. So, initially the question was about sperm, the fertility of males. So, so I would like to start with that. The fertility will be reduced. Yes. Why is that? It's because of that the flagella that is present within the sperm itself has to be formed from microtubules. If this does not happen, there will be sperm dysmotility. The term that we use is, there's a specific term that comes with this. It is asthenospermia. Asthenozoospermia. I'm sorry. Asthenozoospermia. Right. In addition to that, you would also see that since the mitosis is disrupted as well, because the spermatogonia has to produce primary spermatocytes and then differentiate to secondary and then spermatis. During this whole formation and the differentiation of spermatozoa, it has to undergo mitosis. So if the mitosis is somewhat disrupted because of the fact that there is no microtubules present, then what would happen is that the number of sperms that are produced per unit time would be reduced. Hence, you would see that there is the possibility of oligospermia, where the sperm count is reduced as well, and there is a possibility you would see azoospermia as well. So azoospermia is where there is no production of sperms, whereas oligospermia is usually the count is reduced. In addition to these, you would also see the possibility of aneuploidisms. Why is that? If you can remember, why does aneuploidism happen? It's because of the non-disjunctioning of chromosomes. Now, for the disjunctioning, the chromosomes has to be pulled apart. By what? By the microtubules. So if the microtubules are in sparse, it's not found not found in a very abundant manner. What would happen is that it will not function well. So there is a possibility that there will be non-disjunction. Hence, what you would see, there is a possibility there could be aneuploidism in the progenies, which will lead to mutagenic effects. Right. So apart from that, the whole entity of disease that is described with the dysfunctioning of cilia is known as primary ciliary dyskinesia. As I said, usually there's a triad of symptoms. This triad includes, now as cilia plays an important role in escalation of mucus from the respiratory tract upwards. What would happen is that once this is disrupted, there will be stagnation of mucus, which will lead to chronic lung infections, and later on you would see a disease known as bronchiectasis. So chronic lung diseases, frequent lung diseases, you would see this because of the ciliary dyskinesia. In addition to this, you would also see now for the even the mucus gets stagnated within the sinuses. Now there should be a small, there are pseudo-certified epithelia with cilia that has the capacity to waft these mucus in such a manner that it is not kept in a stagnation. So if once this is not functioning well, there is a possibility this individual might get chronic sinusitis. So the third part of the triad is because of the malfunctioning of the vas deferens. The cilia in the vas deferens will not act well, hence the sperms are not transported. Therefore, there is a possibility that there will be subfertility, especially in the males. But is it possible in the females? Yes, because the fallopian tubes are dependent on the action of cilia as well. So what you would see is that these two features, bronchiectasis as well as sinusitis. In addition to that, you would also see situs inversus. What is situs inversus? Now, if you have gone through your embryology, usually there in the development of the internal organs, there is this small cilia that is present, which will cause the rotation of internal organs, specifically the heart as well as the other internal organs such as the liver and the stomach, which this cilia is particularly important for the rotation of the heart. The liver is involved in as well, but most importantly the heart. So the action of the cilia is important for the rotation of these organs. A individual who has ciliary dyskinesia or defects within the microtubules which will lead to malfunctioning of the cilia will not show this embryologically. Hence what would happen? Usually the heart is seen in the left, but in these circumstances it is in the left because the heart was initially rotated from right to left. But in these circumstances, this does not happen. Hence, you would see a heart in the right side, which is known as dextrocardia, and liver in the left side. So, once these internal organs are found in the opposite direction, you would see a condition known as situs inversus. So these are the three most fundamental features that are seen in primary ciliary dyskinesia. Again, again a problem that is autosomal recessive, a disorder which comes with malfunctioning of the malfunctioning and the maldevelopment and the malproduction of microtubules. So the fourth statement, the defective microtubule structure in flagella causes infertility, yes, both in males and females. True. Actin filament network undergoes reorganization during phagocytosis. As I said, phagocytosis requires change in cellular structure. The cellular structure, the integrity is maintained by the cytoplasm. If the cytoplasm has to function well, what will happen? The cytoskeleton will have to have for the cytoplasm to change and for the cell to flow around, the cytoskeleton should show certain flexibility, and this is formed by the reorganization aspect, particularly that of the actin. So actin filament network undergoes reorganization during phagocytosis is a true statement. As I said, it was a bit of a tough question, usually requires theoretical knowledge. um, I'm sure if you have gone through your biochemistry well, and you have looked at some of the core components in the cell, you would be familiar with the answers. So until next time, thank you.